My name is Dr. Todd Breaux, President of Physicians Urology in the Center for Urologic Health, here for another episode on TalkNHealth. The first topic I'm going to discuss today is hematuria, or blood in the urine. It's a common condition that I receive referrals for and is fortunately most often not serious and something that can be managed relatively easily. Blood in the urine can be present for a number of reasons, most common of which is a simple urinary tract infection. Blood in the urine, however, can also be an indicator of more serious conditions such as cancer of the kidney, bladder, or prostate, as well as kidney stones. For that reason, it's important to evaluate this condition to make sure that one of those causes is not present. If your physician finds blood in the urine, or you see blood in your urine, you'll be referred to a urologist such as myself, and we do a standard evaluation which includes a CAT scan to evaluate the kidneys and the internal organs, a cystoscopy which involves looking in the bladder with a small camera to make sure we don't see any tumors or lesions on the lining of the bladder, and finally checking a urine cytology to look for cancer cells, as well as a urine culture to rule out bacteria. In men, we'll also be sure to evaluate the prostate with a PSA test, as well as a digital rectal exam. Once this testing is complete, we'll obviously evaluate the findings and treat any conditions that we find appropriately. As I said, the majority of times there's not a serious cause for blood in the urine, but if there is, then it's obviously something that needs to be identified and treated. The cystoscopy portion is the only invasive portion of the evaluation, and that's done in the office with a flexible camera after the application of numbing jelly. It is uncomfortable, however, not painful, and the whole procedure only lasts about 30 seconds and is very well tolerated. As I said, once this is done, this along with findings of the other testings are brought together to decide if any additional treatment is going to be necessary. The vast majority of times, about 70 to 80% of the time, we don't find a cause, and this is something that's called exercise-induced hematuria, or jogger's hematuria. Some people will show blood cells in their urine simply from their active lifestyles. If that is the case, it's not something that needs any intervention, and again can be followed conservatively. After the initial evaluation, we do follow you for the next several years by just checking the urine for cancer cells again to make sure that a more serious condition does not develop. If I were to look in the bladder and find a bladder tumor, for instance, or find a kidney tumor or other abnormalities such as a stone on the CAT scan, then we would go ahead and treat that condition appropriately. Most blood is found under the microscope by your physician, but occasionally you can have gross hematuria, meaning it's visible to the naked eye. Even after a negative evaluation, if a patient does see blood in their urine in the future, it's important to come back to the urologist, as the entire workup would need to be done again. The most serious conditions, as I mentioned, are relatively rare, especially if there's no family history, and as such, in general, these are relatively simple workups that can be done quickly and effectively here in your urologist's office. If you have any questions regarding this matter, you can certainly call myself or one of my partners, who would be more than happy to assist you.